And here.
Yep, we're all set.
All right. Good afternoon, everyone. Thank you for joining the Greater Danbury Chamber of Commerce on one of our weekly Zoom calls. My name is PJ Prunty. I'm the president and CEO of the Greater Danbury Chamber of Commerce, and we are fortunate to be joined by United States Senator Chris Murphy on our call today. We will hear from the senator as he will provide an update from his perspective on COVID-19, and then we will jump into a Q&A session. I received several questions ahead of our call today, but I encourage those interested to utilize the chat feature on Zoom to be able to submit a question during the senator's opening comments, and then as we're going on to the Q&A. So with that, Senator Murphy, thank you very much for taking time out of your busy schedule for joining the Greater Danbury Chamber. Welcome.
PJ, thanks so much for having me, and really pleased to be able to join you for a little while this afternoon. As many of you know, we're going to be back in session starting this evening, so I'm actually in Washington right now getting ready to head over to the Capitol for evening votes, and then we'll see what the rest of the schedule brings us. Listen, we're obviously at a very critical time in Connecticut. We have seen some grassroots of progress over the course of the last week. Chiefly, we've seen a decline of hospitalizations, a leveling off in terms of the percentage of tests coming back positive. And the governor is hard at work, along with the congressional delegation, trying to figure out the right plan, the safe plan to reopen our economy. I'm just frankly in awe, of the business community in Connecticut from the very beginning. I've been in close touch through the chambers, also directly with hundreds of businesses in the state, trying to figure out what you need, trying to figure out the adjustments that we need to make when it comes to the programs that we're standing up. And I just hope that this chat is an invitation to keep that dialogue going. Obviously, it's really important to remember that this is an economic crisis of a, frankly, scope we have not seen since the Great Depression that is caused by a public health crisis. And so if we get the public health response wrong, then there is, frankly, no amount of economic stimulus, whether it be 4 trillion or 10 trillion, that can fix this problem. And so as policymakers, we've got to make sure to sort of keep the health crisis front of mind, and then also make sure that we're doing everything we need to do to make sure that this isn't a mass extinction event for businesses all across the country. And I fear that we may already be there in some sectors. So as we get ready to open in Connecticut, what keeps me up at night is testing. All of the experts tell us that the only way to adequately reopen your economy is to be able to do widespread testing, not just of symptomatic individuals, but of asymptomatic individuals as well, especially in critical places. And frankly, Danbury has a lot of those critical places. Not only do you have densely populated neighborhoods, where frankly you've had a lot of folks who have been going to work regularly because they work in essential professions over the course of the last 2 months. You've got a prison, you've got a very busy hospital, and you've got a multitude of places where in an ideal world, you're going to be wanting to test people who are not showing symptoms just to make sure you're getting on top of an outbreak. So I have been working this problem every single day, talking to the governor and the governor's staff virtually daily. Last week, I wrote a piece of legislation and convinced 46 Senate colleagues to sign on to it that we introduced last week that would temporarily federalize the supply chain for all sorts of medical equipment necessary for this crisis, but in particular testing equipment. We've got a real problem right now in that we have 50 different states and thousands of hospitals competing to get the components of tests and testing machines necessary to ramp up testing. And there's a lot of mismatched supply and demand. So we're hopeful that our colleagues will take a look at that legislation as we convene this week. We also, in the replenishment of the PPP account last week, boy, was that last week? I think that was last week. I lose track of the days now. We also included $30 billion for additional funding of testing, because we're just going to have to create more capacity. That money's going to have to go to academic labs, to private labs, so that we can just build more testing machines and process more tests. So I just want to share with you sort of what keeps me up at night right now, and our ability to open is based upon how much testing we do. My nightmare, and I know the governor's nightmare, is that we start to open up in late May, and we have a spike, a surge. And the way that you contain those spikes and those surges is by doing a lot of testing. Okay, so that's my sort of healthcare worry right now, and I'm workshopping that on a daily basis. I know we're going to want to talk a lot about supports for businesses. The state has finally, I think, fixed their problems with the unemployment compensation system. I think we are now to the point where in the next couple of weeks, we'll be able to process claims in regular timeframes. That was obviously a nightmare when people were waiting 2-3 weeks for benefits to come back. As you know, there's supersized benefits. The PPP program, I know a lot of you have provided feedback to me. I'm just going to be honest with you. I spent, in reaction to a lot of your concerns early on, a couple days writing a piece of legislation that was the alternative to the PPP program. I did it with a couple other senators. Our idea was not adopted. What we had proposed was to run the program through the Department of Treasury rather than through banks. There's reasons to do it on both sides, but our worry was that banks were going to play favorites is the wrong word, but the banks were going to sort of, take care of their existing customers first. And that a lot of small businesses that were either unbanked or didn't have lending relationships were going to be left out in the cold. And I think that has happened to an extent. And so we continue to see changes to the PPP program, in particular to make sure that every business that qualifies gets a loan, not just the ones that sort of make sense for the bank itself to do business with. Then lastly, we obviously have a time problem here where these loans are good through the end of June, but it's not clear we're going to be open in total by the end of June. And there certainly will be some industries like the hospitality industry that may be open, but have legal restrictions that are going to mean that they'll be in continued need of financial support. We also have this crash happening right now between the unemployment benefit system and the PPP program. You got a lot of, I talked to a bunch of my friends this weekend who took PPP loans, who had laid off their employees, and now are trying to go scramble their employees back to work. And that's A, hard, and B, it may not work. And so you got to figure out what to do if you've taken a PPP loan and a sizable percentage of your employees say, you know what, for the time being, I'm going to stay on unemployment benefits. It took me 3 weeks to get on. I just would rather stay there. So these are all super real world problems. None of them are really ideological. I mean, we're really just sort of sitting down with each other, Republicans and Democrats, trying to figure them out. And so I just want to make sure you all know that I'm, I think, in the weeds on a lot of these issues, trying to get deeper into the weeds and talking regularly, not just with my Democratic colleagues, but with my Republican colleagues about how we fix it. I don't know that we're going to pass another piece of legislation this week or next week, but I think within the next 30 days, we will pass another piece of relief legislation. We can talk about what will be in there, but there may be some changes to UI and PPP as well that obviously we want to be working with you all on it. So again, thank you from the bottom of my heart for being business leaders, for being moral leaders, for reaching out and providing a helping hand where you can. I mean, it's just been amazing to watch what folks have done in Connecticut, and especially in the Danbury area, which has been obviously the epicenter of this crisis, the origin of Connecticut's crisis. You guys have had a much heavier lift than others. So, okay, I will stop there and turn it over to questions.
I appreciate your time, Senator, and all the hard work that you put into this. We just got a question in from Doug Polistena, who's actually the general manager at the Ambroom, which you've been to probably more times than you can count. Doug, obviously in the hospitality industry, and you touched upon this with the PPP and how it's been an effective tool for the paying the employees. However, moving forward, as he's the catering venue, would like to see if there are any plans with you and your colleagues for federal relief in the pipeline, sort of moving forward, right? And you touched upon it briefly, but what kind of conversations are out there about that?
Yeah, so active conversations started up a few weeks ago. We've been talking in the Senate about sort of what the size and the scope of the next program should look like. This is just me talking. I don't think it's PPP. PPP is designed essentially as an alternative to the unemployment compensation system. It's not designed for businesses that are operating. It's designed to just pay employees, keep them tethered to your business so that you can reopen with them, and so that we don't put all of that burden on state unemployment comp systems, which ultimately, by the way, are paid for by businesses.
Right.
And so that's the design of that system. So when we think about the next business support system, which I think is necessary, it looks something different than PPP, because it's probably not as much money. It might be tailored to industry, depending on, some industries will be able to ramp up quicker than others are. And so there'll have to be some different calculation about how much money you're going to get and whether it's all free, whether part of it's a loan and part of it's a grant. But there's got to be something that comes after this, because of course, all of our worry is that all this PPP money will be wasted. I mean, not wasted, right? It's not wasted in that it paid people for a period of time, but the intent was not just to pay employees. The intent was to allow businesses to survive. So if you get the PPP loan, you survive until June 30th or July 15th, and then all of a sudden there's nothing to help you on the back end, and you go under once the economy opens up, then the PPP program didn't work. So don't know what that is. It's not, I don't think it's PPP. I think it's something that looks similar to it, but is probably less money, maybe done in combination with grants, and maybe industry specific.
Sure. Okay. I appreciate that. And then just a few weeks ago, you along with Senator Shantz of Hawaii announced legislation to create the America Forward Commission. And we talked about, from a state perspective, Governor Lamont's Reopen Advisory Council. Can you provide us an update on that commission's work? And then we actually just got a question from one of the council members in Danbury as far as what can we expect for the timeline for May 20th. And this is realizing there are many variables and factors, just sort of your perspective as to what, what your feeling is on that.
Well, as Dr. Fauci said a million times, it's not as if the lights all come back on. So I think our hope is that if we can see, particularly this week, the trend lines continuing to move in the right direction, that we can be in a position on May 20th to start opening up certain businesses, to start opening up certain state assets. And then we frankly just have to watch, right? We have to watch to see what happens and make sure that we didn't make a mistake. Listen, we've never done this before. This is partially trial and error. And I know that takes Herculean patience. But the public health professionals tell us that your biggest danger right now is reopening too early, because you essentially we didn't do what Sweden did, right? We didn't decide to invest in herd immunity. We decided to sort of step back, shelter ourselves. That means most of us don't have the antibodies, so that if we launch too quickly, you basically, are feeding red meat to the wolf pack, and we're going to be in a worse position than we were even at the height of this crisis. So that's why the steps taken on May 20th will be small. Senator Schatz and I introduced that legislation with a number of our colleagues, not coincidentally the same weekend that President Trump retweeted a Fire Fauci hashtag. Listen, I think there are always going to be political considerations that get mixed with public health considerations. Politics gets to be, it has a pejorative sense about it, but politics is really listening to the people you represent. And so every leader is going to have to sort of listen to what the public wants and then listen to the recommendations of public health experts. I think this president far too often is listening too much to his political judgment and not enough to his public health judgment. And so what we did was put in legislation to set up a totally non-political public health panel to make recommendations for reopening, so that at least we'd have a national commission that could give us pure public health recommendations. And if the president or any governor wanted to sort of deviate from that because of political concerns, at least we'd all see it. At least we'd be able to see the deviation. Maybe not in response, but maybe not coincidental to our legislation, the president did put out this plan to reopen America, which is not an awful plan. I think it's a little too rosy. I think it moves a little bit too fast, but I think that plan was by and large written by health professionals. And while it's insufficient and a little too aggressive, in many ways, it sort of serves as that guidepost. And I was glad to see it, even if I didn't agree with everything in it.
All right, and then for those joining us, a reminder, if you want to submit a question, we are taking them in through the chat feature there. at the bottom of your Zoom screen. So just last week we saw pretty bleak picture. I'm refreshing Capital Report like 16 times every hour almost, just to kind of get some information from the state. Pretty bleak, forecast in the budgets coming up and the deficits for the state of Connecticut. Do you think that the federal bailout dollars should be sent to states to replace that state level loss of both taxes and fees revenue?
Yeah, absolutely. I think one of the main priorities that Congress has now that we reconvene is to make sure that these dollars we're sending to the states can be used to fill in what are enormous gaps. I don't know that the administration has implemented this funding in the way that it was meant to be implemented. We said that this money should be used for COVID-related expenses. To me, that meant, to me, it was obvious that that money could be used to fill budget gaps, because the entire reason that you have a budget shortfall is because of revenue dropping through the floor. We can have a discussion about Connecticut's budgeting practices, but we were on track to have a balanced budget. And we are not going to have a balanced budget, not because of a decision the legislature made, but because of this increase in expenses and decrease in revenue. And so the administration has said, no, actually, the $1.3 billion the state of Connecticut is going to get can only go to expenditures related to COVID. Now, we're not going to have $1.3 billion in COVID expenditures that's not reimbursable from a health insurance or Medicaid or Medicare. But we are going to have a budget gap that's that size. And so I think you heard Senator McConnell sort of say these very strange things about not wanting to subsidize blue states, which is so fantastically ironic, because every single year, Kentucky gets about $40 billion more from the federal government than they send in taxes every single year. Connecticut gives about $10 billion more to the federal government than we get in spending. And so we've been bailing out Kentucky for 40 years. We now are in need, and we're asking our friends around the country to help us. So I think he's backed down from some of those comments. I think we will be able to get some ability for federal dollars to be used to backfill revenue shortages. That's my belief as I sit here talking to you on Monday afternoon.
It's Monday? Yeah, it is Monday, right? It seems like we lose track of the days. You talked about testing and how critical that is. It seems to be, reopening the economy. And there's the general consensus that that absolutely is accurate. And the Defense Production Act, which is something that you've talked about a lot recently, and you discussed this in your opening comments about the Medical Supply Transparency and Delivery Act. I think it's worthwhile for you to circle back on that and just sort of further elaborate how important that is to be able to get this economy open up, and the health, again, being the main concern there.
Yeah, listen, the Congress had foresight 60 years ago. It passed something called the Defense Production Act, and it recognized that in times of national crisis, there are certain inefficiencies in the free market that don't support the nation's security. And so it gave the president these temporary powers to take over parts of the manufacturing and distribution system in times of crisis. Now, normally you think about that in a time of war, but this is a similar crisis in which there's pandemonium out there today when 50 states and thousands of hospitals are competing against each other for scarce resources. What it means is that those states and hospitals have to spend an exorbitant amount of time just trying to find the stuff they need in order to practice healthcare. Second, they are paying way more than they should because, when the resource is scarce, there's a incentive for price gouging. There's no limit to how much, frankly, the state of Connecticut will pay these days if we could get a testing machine here. And then lastly, the supply goes to whoever will pay the most. And there is often an inverse relationship between the states that are in the position to pay the most and the states that need the material the most. The states that have the biggest healthcare crises have the least amount of money. And so it's just not working. It's just not working. And so last week we did, thousands fewer tests in this state than we would have if we had swabs. We didn't have swabs last week. Now these are not hard to make. And if President Trump 2 months ago had gone to 6 manufacturers across the country who had the capability to switch over their manufacturing to make swabs, told them to make them, gave them a fair price for it, we wouldn't be in this position today. But the president has refused to use the powers in the Defense Production Act. The legislation I referred to that we introduced last week would require the president to do that. In fact, would empower a civilian in the federal government to be able to exercise those powers. And listen, they should be limited and they should be temporary. I don't want the federal government monkeying around permanently in the medical supply chain, but I do think for the time being, we need to have greater visibility and greater production and more distribution according to need than we have now. And our hope is that that legislation will be considered in this next relief package.
Sure. This next question comes from one of the nonprofits in our region regarding the letter that you signed last week, urging congressional leaders to provide emergency funding to behavioral health organizations in the next round of funding. Do you by chance have an update on this request, and do you feel that there is strong support behind this?
I don't have an update. Obviously, all of us in the Danbury area who've gone through the Newtown crisis know that when someone is taken from this world unexpectedly, there's a ripple effect, and there are 10 to 20 people, studies show, that experience diagnosable trauma. Now, obviously, that trauma, the ripple effects are bigger if it's a homicide, especially if it's a child. But when a loved one is taken unexpectedly before their time because of a pandemic, there's still a lot of grief. And so we've got a lot of mental health needs out there. On Friday, I went down to one of the nursing facilities in Connecticut with Governor Lamont and Senator Blumenthal that only treats COVID-related patients. And my God, what a miracle these people are that run that facility. I mean, every single patient in that facility is COVID positive. Most of them are elderly and very sick. Many of them will die. Those health professionals are going to need serious mental health counseling, many of them, after this is done. So we put in this legislation to try to at least sort of set up for our colleagues this ask of some additional money for mental health clinics so that they can staff up over the summer to be ready for what I think will be a pretty big onslaught in the fall of demand. No update. I think that's on the list of topics to discuss for the next package.
Yeah, appreciate that, and you're further explaining that. So you can just a jump back to PPP. One of the questions we got in the chat, again, might be getting to the weeds here. When do you expect tangible guidance being issued on PPP forgiveness under Section 1106?
I don't know all the section titles, but we obviously have this outstanding question about the end term of these loans. It just doesn't feel to me like June 30th is a realistic date any longer, especially because we don't know what's going to happen in Connecticut once we reopen. I mean, again, we might be in a position where we sort of stop and start a little bit. So one of the topics that we'll be talking about now that we're back is whether we need to extend that. Anybody that has specific questions on PPP, I am not the real expert in this.
Neither am I. It makes two of us.
But I have somebody in my office who is David Tuccio, who's on this call, who is sort of my resident PPP expert in Connecticut. I've got one in DC as well. Anybody who's got sort of very specific questions about when guidance is coming out from Treasury or timing of legislative debates around PPP or EIDL or any of those programs, David Tuccio is working literally around the clock, but he's happy to do so.
Excellent. I appreciate that.
So I tell him.
Yeah, no, I've been getting emails from him all hours of the day, so he definitely is working on the clock. That's great. All right. So last question. You touched upon this is kind of your opening comments, and realizing that the pandemic varies from state to state depending upon what areas are impacted. But where do you feel, sort of as a whole, where Connecticut stands in terms of coming out on the other end of this, so to speak, and realizing that there are many variables, but what sort of you feeling right now where we're at?
Well, listen, I'm proud of the governor. I think he's done as good a job as possible under these circumstances. I'm proud of the legislature. I think, by and large, both parties have taken the politics out of this, and Republicans and Democrats have been working together. Listen, we obviously were going to get hit hard by this, given the fact that the sort of epicenter early on was clearly New York City, and there was no way for that to not ultimately reach Connecticut. We obviously, we're going to see a delayed reaction. So New York sort of hit their peak, then Connecticut hit their peak. But as you see, starting this week, New York may have an infection rate that is actually lower than the country at large, which is remarkable. And that means that Connecticut that's why we're talking about opening in late May, partially because we sort of saw the trend line going up. And so we expect that trend line to move the right direction going down. I will say this, I said my worry is testing. My worry also is some of the data that we're beginning to see about the falling compliance with social distancing orders. If you just look at Google travel data, you saw last week across the country and in the Northeast, folks started to move again. And I can totally understand it, right? I mean, it's just getting, right? It's getting hard. I mentioned to PJ, when I'm here in DC, we're a very small house with 2 elementary school age kids and my wife, teleworking, and, I'm ready to go somewhere else. I think we're all ready to separate and, go to the store and go to parks, and you can start to see people tiring of social distancing, and we've got to stick with this at least for another month or so, and we've got to be vigilant about masks in public. I think that Connecticut has done well. I think we're poised to be in a much better position in 30 days, but what will crater us again is folks deciding to not be compliant with social distancing this month prior to May 20th, people not wearing masks in public, and not having enough testing. And so those are the 3 things, one of which I can control a little bit more than the others, that I think a lot about these days.
I appreciate that. I decided you didn't go with the COVID beard, which I had to wind up doing. When 2 days without.
Yeah, it doesn't really, with my Irish complexion, it's not a pretty sight. So once it starts actually coming in, it's nothing that you want to see on MSNBC or CNN. So so anything that I can do, listen, this is iterative. I'm learning on a daily basis. I'm working 24/7 too. I don't take days off. I'm happy to get feedback in any way that I can. And so I appreciate this chance to interact, but any other way you can do it, that'd be great.
Absolutely. Again, we appreciate your time and all the hard work that you're doing, working around the clock to keeping, not just the businesses, but really obviously the residents of the entire state informed during this ongoing challenge that we're going through. So thanks again. Appreciate your time. We will be back here on Wednesday for those listening in for another segment of our new chamber chat. We'll be hosting the president of the Regional YMCA of Western Connecticut, Maureen Rozeski. And then on Friday, we'll be having Stu Leonard Jr. come in to speak to us, give us an update from his end. So thank you, everyone, for joining us. Senator, thanks again for taking out your time. I wish health and wellness to you and your family. Take care.
You as well, and to all the members. Thanks for having me.
Thank you. Take care.